Hello, and welcome to Ask the Expert, an informational short video to address an important topic for patients with cancer, the correlation between cancer and thrombosis. I'm Sam Perry, campaign manager for the International Society on Thrombosis and Hemostasis World Thrombosis Day campaign. Today, we have a very special guest, and we are pleased to welcome Professor Simon Noble of the UK. Professor Noble is a Marie Curie professor in supportive and palliative medicine at Cardiff University. He's one of the world's leading experts in cancer-associated thrombosis and the medical director of the charity Thrombosis UK. Professor Noble, thank you so much for joining us today.
Thanks very much for having me, Sam. And let's from the start call me Simon. We're all flesh and blood here, so no point in standing on ceremony.
Of course. Thank you. So research indicates that patients with cancer are 4 times more likely at risk than the general population of developing a serious blood clot. It's a startling fact that can come as an unpleasant surprise to patients fighting cancer. We are very lucky to have Simon here today to share information and to answer commonly asked questions that will help patients understand if they're at risk and to share what they need to know in order to help prevent blood clots. Simon is a global leader in supportive care for people with advanced cancer and non-malignant diseases. He's dedicated a great deal of time and research into understanding the patient experience and learning what's important to them. Before we begin, we'd like to know a little bit more about Professor Noble's experience in the field. Simon, can you share a little bit about your background and why you focused on cancer-associated thrombosis?
Yep, certainly. So I was not your classic clever doctor. I always wanted to be a doctor, but I had to take exams, retake exams a few times. And what we found every time there were exams is the academic bits I wasn't very good at, but anything clinical, I did well. So, for example, there was one set of exams in medical school where I was top of the year for clinical skills. So assessing a patient, talking to a patient, and yet I did badly in one of the more academic exams. So I've always been very patient focused in my care. And I specifically remember one patient called Joyce when I was a junior doctor. And she came in with a heart abnormality and breathlessness, which I diagnosed with as having a pulmonary embolus, which is a blood clot on the lung. But I also noticed that she was jaundiced. And I went and looked this up and realized that I thought she had cancer of the pancreas. And I read up about the association between blood clots and cancer. So that was the first time I'd ever seen this. And I became very interested in it because these people didn't seem to do very well. The blood clots weren't treated very well. So I always remembered that. And then in later time, when I was going through my training in palliative medicine, I saw this over and over again. These patients with advanced cancer were getting blood clots, and it was really hard to treat them properly. So my boss told me to go and spend some time with one of his friends from medical school, who was Professor Beverly Hunt, who you know well because she's chair of the organising committee of World Thrombosis Day. And the time spent with her was an absolute inspiration. And from then on, we kept in touch. And whenever I had any ideas, I'd bring them to her and we would talk about them. And all the way through, I was just thinking, none of these papers are looking at the patient experience. And yet I'm seeing people have an absolutely awful time. And science got better. Science got better at treating clots and investigating them. But no one was paying attention to the patient journey. And so I started doing research into that field. So why am I an expert? Not because I'm clever, but because I was the only bloke who did any research about this stuff. There's a saying in the world of the blind, the one-eyed man is king. And what it's really meaning is, in a world where there are very few people interested in a topic, it's very easy to be the expert if you're the only one looking at it. Now, over the years, it's been great. People have taken more and more interest. The patient voice is being heard. And actually now we are campaigning against what I call it, we're campaigning against nappies, which stands for no apparent patient public involvement or engagement. So I don't like seeing publications coming out or guidelines coming out that haven't involved the patients in some way. So no to nappies.
Thank you for sharing. That's very inspiring, and I'm sure that patients appreciate your ability to share information in an understandable and digestible way. We've also heard through the grapevine that you've created some songs to help explain complex topics, which is very impressive.
Yes, I think what you're getting at there is there was a conference in which I was asked to take part in a debate against one of the greats in cancer-associated thrombosis. Just to be on the same stage as him was both an honour and daunting. And there was no way I was going to win that debate with the facts. So I felt I had to do it with charisma. So I ended up presenting my debate as a rap. And I believe that if you were to Google or if you were to go onto YouTube with cancer-associated thrombosis hip hop, you would probably see it. But probably that's all I can say on the matter.
I'm sure that you got a standing ovation for the rap, though.
Well, it's easy to impress people.
So for our first question today, can you explain why patients with cancer are at a higher risk of developing blood clots over the general population?
Certainly. What I'm going to do first is just explain to people that clotting is a normal part of our body's healing process. If I were to cut myself, I'm glad that I have a clotting system which will make a clot to prevent me bleeding anymore. And as good as our body is at making clots, it's also very good at reabsorbing clots as well. So we are constantly making clots and reabsorbing them. If I took a microscope to my brain, I would see that I'm having little microbleeds all the time, which don't come to anything because the body is forming clots to stop it bleeding. And then when those clots are no longer needed, they're being reabsorbed. So we have this constant sense of flux of making clots, reabsorbing them. Now that system sometimes goes awry. And there are things that can increase your risk of having clots. Number one is stasis or lack of movement. So if you are not moving around, if you are immobile, the blood tends to sludge in the veins, usually the veins of the legs. That's why we encourage people to keep as mobile as possible. Another thing that does it is if there is inflammation in the body or inflammation of the blood vessels, which causes the release of molecules that make the blood more sticky. And then things that can cause that would be operations, for example, or a tumour eroding into a blood vessel. And then finally, there is just having more sticky blood. They call that hyperviscosity or hypercoagulable blood. And that often happens in cancer because the cancer cells release molecules that make the blood more sticky. Now, some cancers are more sticky than others. And I think we're going to talk about that in a minute. But if you imagine those things all coming together, immobility because you're not well because of the cancer, or because the tumour is pushing on some blood vessels, slowing the flow of blood, then you've got inflammation because cancer is an inflammatory process, or you've had chemotherapy which has inflamed the blood vessels. You add on to that the cancer, you've got a perfect storm to form blood clots. Now, the other thing we know is the more advanced the cancer, the more risk of blood clots there are. Okay. So, for example, if we were to look at someone with early stage cancer, say breast cancer, for example, the risk of blood clots with curative chemotherapy may be 2 per 1,000. But someone who has got metastatic breast cancer, who is receiving chemotherapy, the risk goes up to 8%. So different stages of cancer, the more advanced the cancer, the greater the risk of blood clots.
That's very informative. Now, you had mentioned that specific types of cancer are associated with a higher risk of developing a blood clot. What are those specific types of cancer?
Well, we've got a lot of epidemiological data, so data of thousands of patients, which will have looked at the rate at which people get blood clots. And we know that cancers such as brain tumours, so glioblastomas, pancreatic cancer, stomach cancer, esophageal cancer, lung cancer, ovarian cancer. These are all very high risk, as well as some hematological cancers as well, so myeloma, for example. Cancers which are less clotty are tumours like breast cancer and prostate cancer. But I see in my clinical practice a lot of patients with breast cancer who've had blood clots, and a lot of patients with prostate cancer, because they are such common cancers that although the proportion of them is small that get clots, it's so common I see many of them. The other thing is that people are living longer with cancer. Oncologists have got so good at treating cancer that people are living longer. They're living into older age with cancer, and they continue to have chemotherapy and systemic anti-cancer therapies, third line, fourth line. So the chemotherapy also increases the risk. And if you have metastatic disease, the risk goes up. So the way I look at cancer and a blood clot is that is a bar that you need to get above to get the clot. And you have lots of risk factors adding up. And when you have enough of them, it tips you over this threshold that you get a blood clot.
So speaking of risk factors, what are the thrombosis risk factors, and are there any that are increased with patients with cancer?
I think the most important things, there are risk factors which we can do nothing about. So one is age. We know that as your age goes up, your risk of blood clots go up. So that's irrelevant to whether you have cancer or not. Also, some people have naturally sticky blood. That's only a minority though. Anyone who's immobile, so if you've had surgery and you've taken to your bed, or you're having chemotherapy and you don't feel well and you take to your bed, those things will increase the risk. Being dehydrated will increase the risk. So you're not feeling well after chemotherapy, you're not drinking as much, you dehydrate, your blood becomes thicker. But in my practice, the most common thing responsible for people getting blood clots is chemotherapy and other anti-cancer therapies. They call them SACT, or systemic anti-cancer therapies. 60% of my clinical practice, people will have had the clots precipitated by chemotherapy. If we look at data, 53% of people who get a blood clot during the cancer journey do so in the first 3 months of their cancer diagnosis. Now, I'm sure that that is due to the fact that early on in their cancer journey, that's when they start their chemotherapy. So we often see clots very early on.
Can you explain why chemotherapy is a risk factor in developing blood clots?
There are lots of different chemotherapies and lots of different systemic treatments, and the mechanism varies depending. There are certain things which we do know. For example, some chemotherapies are very inflammatory to blood vessels. In fact, you often use central lines, which are long tubes going into the large vein in the blood vessels, to try and avoid the blood being too inflammatory. But we certainly know that certain chemotherapies increase inflammation and therefore increase the risk of clots. Some chemotherapies decrease the levels of the body's natural anticoagulants, or decrease factors which break down the clot as it's being formed. Also, some chemotherapies will increase the release of procoagulants. That means things that make you more likely to have a clot. There are molecules such as something called tissue factor, which you may see increase during chemotherapy. And then if you add on to that all the things that happen to us when we're feeling generally rubbish after chemotherapy, so we're not eating much, we're not drinking, so we become dehydrated, we take to our bed rather than going out for walks, all of those things will contribute. Now, the other thing that we have noticed is that sometimes some chemotherapies are more clotty than others, but also some, it will be a cumulative effect. So the longer you're on that chemotherapy, the risk goes up. So it may not be your first cycle of chemotherapy, but perhaps your third cycle that we will see people getting the clots.
What are some of the symptoms that patients with cancer should be looking for?
Well, I think the symptoms that you need to be looking for are varied. The difficulty with clots is that they can range from having no symptoms to having such severe symptoms that you pass out and become unconscious. But if we start from the beginning, so clots usually form in the legs, in the deep veins of the legs. So it's called a deep vein thrombosis. And what that clot will do is it will block the drainage of blood from the legs back into the body. So it may cause a back pressure of blood. The common things we'll see will be pain in the leg, often pain in the back of the leg, in the back of the knee or the calf. There may be swelling, and that may be in the calf or it may be the whole leg. You may get redness. They call that erythema. So you may get one of those, may get a mixture of them. But I think if someone is getting pain in one of their legs or swelling in their legs during chemotherapy or during their cancer journey, they should have a low threshold for seeking medical attention. I don't remember the number of patients who've come to me and said, I think I have a clot, and they didn't. But I certainly remember the patients who never mentioned it and then come with a large clot or come very sick because they didn't have the clot treated. Now, the clot in the leg, the deep vein thrombosis, if untreated, may then get bigger and pieces may break off and travel through the bloodstream and end up at the lungs. And that's called a pulmonary embolus. Now, depending on the size of the clot that goes to the lungs, may determine symptoms there. Symptoms may be breathlessness, there may be pain, chest pain, they may cough up blood, and a large clot, which is big enough to actually obstruct blood flow through the lungs, could leave you to pass out or could even be fatal. So that's why we take clots in the legs seriously, because we are wanting to prevent a blood clot on the lungs. However, 80% of clots on the lungs will be in people who've had no symptoms in the legs at all. So someone saying, well, the legs were fine, this can't be a lung clot, it can't be a pulmonary embolism, that's nonsense. Now, the difficulty is that if you say to a cancer patient, have you felt breathless? They often do, because there are lots of things associated with cancer that can make you breathless. You could have a chest infection, you could be anemic, you may have developed fluid on the lungs, you may even have tumour on the lungs which is making you breathless. You may already have a lung condition that you normally feel breathless with. But my advice is, if anyone has breathlessness which doesn't have an obvious explanation, or their breathing has changed, it's something that needs to be looked at and needs to be ruled out in the very least.
So what can the patients do to help prevent blood clots?
I think there's a few things. Number one, I think when they see their cancer specialist, they should ask, what are my risks of developing a blood clot? I think they need to make their healthcare professionals aware. There are some cancers now that the guidelines would recommend you have a prevention medicine, a prophylactic medicine during chemotherapy, because the risk of getting clots is so high. We know that patients with myeloma who are receiving certain chemotherapies, it is routine practice to give them thromboprophylaxis. That means prophylaxis, prevention against clots. Pancreatic cancers as well, the guidelines recommend prophylaxis. There's also been some studies recently which have looked at patients who statistically are at a higher risk of developing clots by using a risk assessment tool called the Khurana score, named after Dr. or Professor Alok Khurana, who developed it. And that will show which people are most at risk of getting blood clots according to certain measures like the type of cancer, the certain blood results, their weight. And that may identify who is at additional risk and may be considered for prophylaxis. So number one, patients, I believe, should never be afraid to ask their doctor whether they are at greater risk and should they be having prophylaxis. Number two, I think wherever they can, keep hydrated so that the blood is less likely to become sticky. Number three, try and be mobile. And if you're not able to be mobile, at least move your legs around. Just having your feet, doing that with your feet, will increase flow up the leg. So just doing that, wiggling your feet around will make a difference. And then finally, be aware of the symptoms which are suggestive of blood clots and seek help sooner rather than later. Now, when I was first doing research into this field, your average cancer-associated thrombosis patient, when they'd had a blood clot, I was seeing people, most of my patients wouldn't live a year. So we didn't even look at long-term complications of blood clots because you never lived long enough to get them. We are now seeing people living with metastatic cancer for years and years. Certain cancers like breast cancer has almost become a chronic disease because doctors are so good at keeping people, they're so good at keeping people well with that cancer. So we're now seeing people with cancer who, when they originally had a clot, because it wasn't treated soon, they've now gone on to develop long-term complications. One such complication is post-thrombotic syndrome. That's when the blood clot has caused damage to the valves in the leg, and those valves are normally there to stop blood coming down the legs again and swelling. But if those valves get broken, blood continues to pool in the legs, and these people may get chronic swelling, they may get chronic pain, they may even get ulcerations of the legs. And that is a lifetime diagnosis. So therefore, it's not only important to get the clots diagnosed and treated early as possible, because you don't want to have a large clot causing problems, it's also thinking about the future and making sure you don't have the complications of a clot long term.
So you briefly touched on this. When speaking to a doctor, what should patients with cancer be asking?
I think the first thing I would say is that when you're diagnosed with cancer, you are going to find it really hard to take on board all the information. You are still reeling from the diagnosis. You're thinking, oh my gosh, am I going to live? Am I going to die? What about my family? What am I going to do? They're going to tell you about the treatments and they want to inform you about them. But you don't take much in because your mind is a whir. So they will tell you what they believe are the most important things to tell you. And they will really emphasize things that are common that we see. For example, if you give someone chemotherapy, their immune system gets damaged and they're not able to fight infection as well. So you'll be told very much what to do if you get signs of infection, that you must get into hospital quickly. They don't always emphasize the risk of blood clots. So I think you have to say, what is my risk of blood clots? What are you going to do to help minimize my risk? And if I have symptoms of a blood clot, what should I do? I think we need doctors, nurses, cancer specialists need to take responsibility for this as much as we wish to empower patients to ask about it. Now, I want to be clear, I am not making out one moment that our cancer specialists don't take clots seriously. but clots are one of many complications of chemotherapy that they will have to cover, and it's one of many complications of chemotherapy that they need to identify and treat. So it's easy for me talking about clots being the most important thing because this is what I spend my clinical practice managing. But what I do know is this: blood clots are the commonest cause of chemotherapy-related death, not infection. The rate is the same as infection. And so therefore, if we are looking at preventing mortality, preventing death from chemotherapy, we need to be giving the same level of attention in preventing blood clots and acting on symptoms of blood clots quickly as we do for infection.
Before we close out our video today, do you have any additional information that you believe patients with cancer should know?
Certainly. I think the first thing is that I've seen a lot of people get very distressed when they've had a diagnosis of a clot in their cancer journey because they think, wow, this is a complication, that's a terrible sign, things are not going well. This is so common in cancer that actually I see it as just a normal part of the cancer journey. So I would say don't read anything into it. This is normal. In the same way that you may feel nauseated with certain chemotherapies, you may lose hair with certain chemotherapies, you may get infection with certain chemotherapies, you may get a clot with certain chemotherapies. This is all normal. It's important to have information because when you are first diagnosed with the cancer, your mind is spinning. You're going through the shock of the diagnosis. You're wondering, what am I going to do? How am I going to tell my family? How am I going to manage? And you don't take all the information in. So sometimes you need to get information more than once. What I'd say is there's a couple of really good resources. First of all, there's an excellent video which I and colleagues were involved in making called Cancer, Clots and You. And that was made by Anticoagulation UK. It's on their website, and it's also on the website of Thrombosis UK. So I think that has excellent resources, and that video is really nice. It really explains things carefully. In fact, what we found in our clinical practice was that it meant that people were presenting sooner when they had symptoms of blood clots. Previously, it would take 9 days before someone would seek medical help if they had symptoms of a DVT or a PE. After using this video and putting it into our clinical practice, that number had reduced down to 3 days. So we reduced the rate or the speed at which people presented by 2/3. And I really believe that that saved lives. Also, the presence of that video as video cards in the chemotherapy suite, in outpatients, increased the awareness of staff as well. So I think they had a much lower threshold for questioning whether a patient had a clot. So we need to involve our healthcare professionals, but we also need to feel empowered ourselves to ask about clots, because it's our bodies, it's our health, and therefore we have every right to make sure that if we have this normal part of the cancer journey, we need to pick it up and get adequate treatment for it.
Thank you so much. That is so important for patients to be the best advocate for their own health. And we encourage others to go and look on those websites and watch the videos that are on Anticoagulation Europe and Anticoagulation UK. We are so appreciative of your time today, Simon. Thank you for all of the valuable information that you've shared. For more information on cancer-associated thrombosis, we invite you to visit the World Thrombosis Day website. Additionally, our campaign supporter, Leo Pharma, has developed a great resource for patients at cancerclot.info that has additional information, resources, and videos. Thank you for joining us for today's Ask the Expert. Please continue to tune in to World Thrombosis Day at worldthrombosisday.org and join us on October 13th to help us save lives and raise awareness of blood clots. Thank you so much, and stay safe.